Good evening, it's Dr. Daniel Cameron. I'm here for the second Lyme Hangout. For those of you who came the first time, we discussed cardiac issues in children. Now we're going to be discussing a different issue, which is Babesia in newborns. So I'm going to welcome you to this Hangout. Just to orient you, this is a live recording. There's always an archive afterwards, but during the live recording, you can look at the screen, see some questions below and comments below. You can also see the right hand of your screen, a chapter from my book, Lyme Disease Takes on Medicine. So it allows you to read in the future. Later on, there'll be an archive. Now, there was a lot of interest in this children with Lyme disease, and I was very appreciative of being able to start a dialogue on all these important topics that are out there on Lyme disease. I enjoy writing. I enjoy posting all things Lyme blogs, but this unique opportunity to use my website, Daniel Cameron MD, this unique opportunity to discuss cases is something that I've been looking forward to. I hope you'll bear with me as we work on the quality, as we work on this new format in discussing things. If there are any questions afterwards, don't be afraid to contact me on my Instagram or my Facebook. So I'm going to begin. I find that if I put the case together in a PowerPoint format, I'm able to guide us through this particular article that I was reading and is the subject of this particular Lyme Hangout. The topic is congenital babesiosis. Now, right off the bat, the title of the article that caught my interest was called Congenital Babesiosis After Maternal Infection with Borrelia, burgdorferi, and Babesia microti. In other words, they're addressing a very important topic to my patients. Even though I take care of adults, I always get questions regarding the maternal issues. So this was congenital babesia after maternal infection with two organisms, Borrelia burgdorferi, which was first identified for Lyme disease, and Babesia microti, which led to Babesia. The first author was Sartre from the Cohen Children's Medical Center in New Hyde Park, New York. And this is an area where I practice. I practice in Hudson Valley, New York. It was published in the Journal of Pediatric Infectious Disease Society, 2017. So I'm going to first present the case, then I'm going to go through a background of Babesia, so you really get to look at the case a second time. So the first crack at it, when I first read an article, first look at that article, it came out that this was a woman, a mother, who was 35 weeks into her pregnancy when she developed fever and myalgias, so sore muscles. And erythema migrans rash appeared at 37 weeks gestation, at which time she was treated with amoxicillin, and that's a reasonable treatment. The female infant was born at 38 weeks, had no perinatal complications. It was interesting that the infant, the girl, was asymptomatic according to the doctors, despite a positive Borrelia microti PCR assay. A blood smear was not performed, and I'll go into those details later. A female infant was sent home without treatment. The girl was admitted, though, later with anemia, and symptoms included malaise, tachycardia. The blood smears showed parasites. The hematocrit showed anemia. She was diagnosed with congenital babesiosis. She was treated with azithromycin, which is often known as Zithromax in the U.S., and atrobacone, which is often called Mepron in America. And on day 4, due to persistently elevated parasite levels, falling hematocrit, she prescribed clindamycin, required a blood transfusion, and was treated for 14 days. So what I'd like to do is just back off a second, because there's a case, it's always nice to look again at what we know about Babesia. Babesia is a tick-borne pathogen. It exists in the same ticks where Lyme disease was discovered. Ehrlichia is also the same tick, as well as anaplasmosis and Bartonella. The references to this All Things Lyme blog and the book are all available. Babesia is a parasite that was originally identified in red blood cells on a thick smear if you catch it early. And this is a picture from the CDC website, which is on the bottom of your screen. If you look at the screen up close, you can see in the red cells, there's parasites. Now that only lasts for perhaps a week, 2 weeks, and Babesia might clear up in the red cells, but apparently it still can give troubles, as happened in this case. So Babesia can lead to serious illnesses. It's been shown to cause atrial fibrillation, pulmonary edema, which is fluid in the lungs. In New York alone, between 1982 and 1991, 7 people with Babesia died. Another patient on Nantucket Island developed pancarditis and died. Babesia can increase the severity of Lyme. They found if patients had Babesia and Lyme from the same tick, they were more likely to experience fatigue, headaches, sweats, chills, anorexia, which is a loss of appetite, emotional lability, nausea, conjunctivitis, and splenomegaly, more than just Lyme disease alone. So having both infections makes sense it should be worse, and it actually is worse in this study. Babesia can occur in certain age groups when you have prior splenomegaly, immunosuppression, and prematurity and liver disease, but it also can occur in people who don't have any of those risk factors. Babesia can be symptomatic for years. Krauss in 1994, who has done a lot of work in the field of Babesia, found that 50% of co-infected patients were symptomatic for 3 months or longer. So when you normally hear that they're sick for just a week, this was an extensive, prolonged period of time. And only 4% of patients with Lyme at that time continued to be symptomatic. And Wang in 2000 said 1/3 of patients with a history of Babesia and Lyme remained sick at least 6 years, or an average of 6 years. Babesia can be difficult to diagnose. So even though we always look for sweats, people who have Lyme and Babesia, only 42% said sweats. So you can't count on sweats as your ability to diagnose Babesia. Only about a third in one study had parasites on thick blood smear. The sporocytes from Babesia can be too few. So when you look under the microscope, you can't really see them, especially if you don't catch it right at the beginning of the disease. And the reliability of the PCR and antibodies remains uncertain. So you can't even count on the blood test or PCR very well. Babesia requires different treatment than Lyme. Just for those who might have come in late, I'm Dr. Cameron. I'm leading this second Lyme hangout. We're talking about congenital Babesia. I'm using the PowerPoint presentation to give you some history of Babesia because it isn't something that commonly comes up in your practice. So let me go back to the PowerPoint, then we'll get back to the case. So Babesia requires different treatment. So even though doxycycline works for Lyme disease, sometimes you have to resort to other antibiotics like amoxicillin or azithromycin. None of those work for Babesia. Babesia is a parasite. So you have to use a parasitic treatment like Mepron, which is known as atrovicone, and zithromycin, which is known as azithromycin. Prior to these drugs, quinine and clindamycin were effective for Babesia, but so many people had side effects from quinine and clindamycin, they've moved, in at least adults, to Mepron and Zithromax. And in another study, which involved Dueck, Wasser, Vanier, and Krauss from major institutions on the East Coast of the United States, which is Columbia University, Tufts Medical Center, and Yale, they found that up to 40% of patients with Lyme disease experience concurrent babesiosis. And this article is quite important because most doctors focus in on Babesia under a thick smear when it's in the parasite. But because there's so much more Babesia in the whole Northeast United States, they were warning to be careful. If you're treating Lyme, there's a decent chance of Babesia as a factor. The study also was wondering, how did Babesia spread so fast? We just got used in the last 40 years to Lyme disease, and now a whole different disease, a parasite, pops in that we have to take account for. Very importantly, is Babesia is transmissible through the blood supply. So we're going to be discussing the blood supply, and given the complexity of Babesia, the need to give a background on Babesia, I'll be spending more time on talking about the blood supply, and that's important because in Connecticut, 3 infants were infected with Babesia from a single blood donor. The blood donor was a young man who thought he was healthy, donated blood, and 3 of those infants ended up with Babesia. So let's look again at that original case that I presented at the beginning of the Lyme hangout. And now when you look at it the second time, there's more in that particular story to look at. Remember, at 35 weeks gestation, the mother developed fevers and myalgia. An erythema migrans rash appeared. So fortunately, the mother had a rash. In this case, the doctors were able to identify Lyme, treat Lyme. It's just the doctors only have a few treatment options. Treating for Babesia so far hasn't been something that doctors have routinely treated for. So the hope is that when a mother gets pregnant, is in the 3rd trimester, that amoxicillin will be effective. The infant was born at 38 weeks, and it showed that even with the Lyme, the baby did well. But what's fascinating is that they didn't do a blood smear, but they did do a blood test that showed there was Babesia microti by PCR. Now, the baby was sent home. In hindsight, the Babesia microti PCR was actually a meaningful finding. When the baby girl came back with anemia, malaise, tachycardia, with a blood smear showing parasitemia and an hematocrit of 27.7, it led to the all-important diagnosis of congenital babesia. So it's great that the authors are bringing this to the attention of the medical population and the reader. That's why I brought this up for our discussion. She was treated with azithromycin and atovaquone. Excuse me, I'm drinking a little bit of water. But on day 4, she continued to have an elevated parasite level, falling hematocrit, and she was prescribed clindamycin. So in this case, not only was the girl treated with the azithromycin and atovaquone, but they went back and added another treatment, hoping that they could get control over the parasites. Now, there's quite a few people in the literature, when they get Babesia, there's hemolysis and other illness going on, so they require a blood transfusion. They were treated for 14 days. So I hope by reading that case a second time, you can get more out of that particular case. Now, what's interesting on this case is that the mother's PCR showed Babesia. The blood smear was negative. The mother, remember, the mother was treated with amoxicillin for Lyme. So the mother had evidence of Babesia microti by antibodies, by IgM and IgG. The PCR eventually went negative. So that often happens in practice. The PCR does not always stay positive. The mother did not require any treatment for anti-Babesia or anti-babesiosis type treatment. Now, that, of course, is a problem because lots of times people think that Babesia is asymptomatic. But often they're by doctors who think that Lyme disease has nothing more than aches and pains of daily living. So over time, we find that some people who have Lyme actually are quite sick. The latest study out of Hopkins shows that people who have what they call post-treatment Lyme disease syndrome, PTLDS, actually are quite symptomatic. My concern is that even though the authors noted this woman was asymptomatic, is could this babesia end up being a problem for this mother later on? In that same Congenital Babesia article, the mother had been diagnosed, in this case, during her third trimester, 32 weeks gestation. She presented with an erythema migrans rash and was treated with amoxicillin again. The male child was discharged home, and at 4.5 weeks, the baby presented with a fever 101.7, sleepiness, and periodic irritability. So at this time, the son was 4.5 weeks old, felt ill. The blood smear had a 2% parasite level for Babesia and splenomegaly. And after treating with atrobacone and azithromycin, the baby was clinically well, according to the authors, did not require transfusion. The mother was also positive for Babesia by antibodies, but it was not clear from the article if the baby was treated. So now we have two infants where the title of the article was Congenital Babesiosis. They both had been treated with amoxicillin, which seems appropriate, but unfortunately for the child, the Babesia pops up after discharge, after they're home, when they had parasites in their red blood cells. So in the blog that I wrote, the All Things Lyme blog, which eventually ended up in my book, Lyme Disease Takes on Medicine, I posed these 4 questions. You yourself, as a listener, if you read, you will have your own questions. So one question is, would the complications and need for transfusion for the second infant, have been prevented if the infant had been treated at the time of the visit with B microti PCR positive? That is, if they have a positive test, and the mother had Lyme, the mother got treated for Lyme, would all of the illness that happened to that child been prevented if you had treated at the time of delivery? Second question, could Babesia, if it occurred during the first and second trimester, could it lead to complications or death in utero? So these are some questions that come up when you read an article like this, is that as people acquire Lyme, living in endemic areas, even areas where there's not endemic problems, is how are we going to be able to detect Babesia in a child? This case, the mother presented right at the end of the pregnancy when you could catch Babesia. The third question, would doctors recognize Babesia in a pregnant woman if you didn't have a Lyme rash? This case, women have rashes, but not everybody's going to have a rash. And the fourth question is, should women presenting with Lyme disease during their pregnancy be treated for a regimen that is effective for Lyme disease and Babesia? And in this case, there's always questions about what to give pregnant women, what's been approved, what's acceptable. But I think it's one of those questions that's going to come up in the future as to how to effectively treat women when they get bit by a tick that contains multiple organisms. So if you look at those 2 cases of congenital babesia, you will find that they raise more questions than answers. So let me go back and get on the and join you directly. Now, that may have taken a little while to present these 2 cases, but I think I find that many of my patients don't hear Babesia discussed that often. There's so much focus on taking 3 weeks or 4 weeks of doxycycline, which is a good product, but they don't work for Babesia. So these 2 cases where the doctors were kind enough to share in the literature, in the published literature, bring up the challenges that we have in medicine of what is the best treatment. Now, I've been treating for years, and I continue to find over these 30 years in practice these kind of challenging questions. It's certainly appreciated that these authors brought the details of these two mothers, their two children. Fortunately, both of those children were diagnosed by doctors who were looking for Babesia. One had a blood transfusion. They both were discharged. They're both clinically well. Now, my question is, clinically well in practice is always somewhat subjective, because there's hardly anybody that doesn't have some symptoms. And if you deal with a newborn that's 2 weeks, 3 weeks, 4 weeks old, how does one know whether a kid is asymptomatic? So it shows the complexities that are out there in a world where there's tick-borne illnesses. So I'd like to do is, before I turn it over to comments from listeners, I'd like to tell you that there were 3 other children that were also described in the literature this past year. I put them in my All Things Lyme blog and the book. These 3 babies in the neonatal unit all developed Babesia, and they were able to track down the blood to a young man from Connecticut. So given the complexity of Babesia, I thought it'd be more reasonable to devote the next Lyme hangout to the topic of transfusions, revisit Babesia, revisit the challenges we have on making sure we have a blood supply. There's some other cases that are out there. So it's important to begin to explore Babesia. So those of you who have questions in the comments, feel free to include some of those in the comments section during this live feed. Because I'm on Instagram, because I'm on Facebook, feel free to give some feedback as to what's actually on your mind, what comes up as a result of this Lyme hangout, and so we can schedule future hangouts. The next hangout is going to be in 2 weeks. But for now, I'm going to go back to some of the comments that are coming in during this live feedback. So I'm going to refresh my screen, and I'm using a iPad to take a look at the comments that have been coming in. So the first comment that comes in, someone was asking a question on, I've been reading various articles about success of the in vitro destruction of Borrelia burgdorferi biofilm. So in this case, they're talking about several important issues, which is biofilm. Biofilm is one of those topics that is being explored to find out why some patients who have Lyme disease are so difficult to treat. They know biofilms, which is areas of the body where you can't get antibiotics into, you can't fight the infection, you can't treat the infection very well. Biofilms are in some other bacteria like staph or strep. So they're having a hard time finding biofilms in people, but they have a model in a test tube where they're studying it. They've found that sometimes it can be difficult to treat Lyme in a biofilm in a test tube. So this question has to do with in vitro destruction. In vitro is in a test tube. So we're hoping to learn from the biofilms. Some people feel that if you treat with information from the test tube, that will help treat the more complicated cases of Lyme disease. I find that sometimes it's hard to translate what you put in the test tube to what happens in people. I don't always place biofilm as the front and center mechanism. Main thing is I make sure that I treat Lyme, Ehrlichia, anaplasmosis, Babesia, look for Bartonella. I try to make sure I take care of the direct organisms first, directly with an antibiotic, and try not to go after the biofilm as my main option. The other question was is there anything beyond pulsing with antibiotics? I'm not somebody that likes pulsing. Pulsing is a newer concept, but using antibiotics intermittent. And I think that there's so many other mechanisms like combination therapy, treatment for babesia that I find quite effective. I try to watch the diet, stay away from alcohol, and stay away from simple sugars. And so I think this question addresses when you're really sick, how many different theories are out there that lead to possible treatments that haven't been worked out. So doctors hang in there, patients hang in there as we try to figure out what to do for these complicated patients. The second question is, I was wondering if children who are born with Babesia, what would be some of the symptoms to look for? Would some show low bilirubin? I think it's very hard. I don't take care of newborns, and I think that given that you can't get the newborn to talk back, you can't really address symptoms anyway. So saying they're asymptomatic is difficult. So in these two cases described, they were dealing more with parasites, anemia, splenomegaly, so more of laboratory and physical findings. As children get older, there's always the question, do they pick up an infection over time? Do they pick up Babesia over time? But it shows you the challenges of what to do for diagnosing Babesia, especially if 20, 30, 40% of people with Lyme have Babesia, then you got to always factor in Babesia. Would some show low bilirubin? I don't think that we know too much about the laboratory findings in congenital Babesia. Next comment is, thanks for joining us tonight. Someone's making reference, they're just happy to be here. But if you have any questions, because there aren't too many questions tonight, I think most of the time when you get a subject of this complexity, it takes a while to frame questions. So that's why I wanted to dig into Babesia. With the Babesia, if I dig in deeper with two actual cases described in the literature, there's a lot to learn, but I feel challenged. So I'd like to do is continue this dialogue on Babesia. There'll be some other subjects coming up, like autonomic nervous system issues, PANS and PANDAS, which I'll explain in the future. But for tonight, if we look at the literature together, I am enjoying the process of sharing my passion for reading, breaking an article down, looking at that article and seeing how it applies to the patients I take care of. I realize that it can be frustrating out there to be sick with Lyme, or to have a child or a grandchild who's sick with Lyme or tick-borne illness. But I think the more dialogue we have, the better. Now, I've been beat up over time. There's always criticism between doctors over how to manage Lyme, but I know you're fighting to get better. I'm fighting to get my patients better. I'm fighting for a better dialogue. And so hang in there with all of your needs. And as we get ready for the next hangout, I'm happy to be with you. The next hangout will be in 2 weeks, 8 p.m., which will be the subject of Babesia in these newborn nurseries after blood transfusion. And over time, we'll address other topics. Don't forget to buy my book, Lyme Disease Takes on Medicine. If you haven't read that already, you may find that looking at a book like that, or looking at the blog, or whatever you decide to read, it gives you a chance to take what we learned tonight, reflect on what we talked about tonight, and help get better if you're sick. But the last thing I want to mention is that there are so many people who know somebody with Lyme disease that having a dialogue like this will help everyone work together toward understanding how we're doing in our society with such an important illness as Lyme disease, Babesia, and all the other co-infections. So thank you for joining me. Thank you for joining us, and feel free to join us for the third Lyme Hangout.